Welcome back to Great Day St. Louis. Sports fans know this. The NBA season just came to an end with the Oklahoma City Thunder winning it all. But the real conversation has been centered around the number of Achilles injuries just in the playoffs. What's going on here, and how common are Achilles injuries? We have invited an expert in to answer these questions on this Thursday morning. We are very happy to have Dr. Ali Dalal with us today, a BJC Medical Group orthopedic surgeon at Christian Hospital. Doctor, we appreciate you giving us the time on this. My first question for you, what kind of Achilles injuries can happen, and what are the symptoms?
So Achilles injuries come in two different flavors. You have the ones we saw in the playoffs, which are the sudden acute ruptures. And then you have the more chronic, kind of achy, heel pain type injuries. The ones that we saw in the playoffs are the result of elite athletes playing thousands of minutes in a season, not getting enough downtime, possibly playing through injuries, and then just taking the wrong step. The common symptoms when people have the big one, the one that ruptures the whole tendon, my patients often tell me that it feels like they got kicked in the back of the leg, and then they turn around and no one's there. That's what I hear all the time.
And they instantly know.
Immediately they know.
So the common causes, as you mentioned, of these amazing athletes is just their dynamic, explosive moves, but also a grueling season. What about for normal people?
The common causes for normal people are doing too much too soon. I see it in recreational athletes all the time. People that are, playing a pickup game on the weekends, or maybe trying to get into pickleball, and then, they lunge for the ball, take that wrong step where their foot is on the ground, and then they lean forward, and that is enough.
Let's talk about recovery. First off, is surgery always required? And if so, what does that recovery look like?
So believe it or not, surgery is not always required. A vast majority of patients can be treated without surgery if they get prompt treatment. So the cutoff is getting seen by an orthopedic surgeon within 48 hours so they can be put in the right kind of cast. And for many patients, they can avoid surgery. The recovery is very similar with surgery and without. It's about 6 weeks of no walking and then progressively walking in a device like a boot. But that key is how quickly you get seen. That's what shortens your recovery.
I'm gonna level with you. I don't ever want to see you for an Achilles injury, so how can we prevent these from happening altogether?
It sounds old-fashioned, but stretching. Most people have tight Achilles tendons, and they should probably do a little bit of a warm-up stretch before activities. And the best way I would recommend to stretch is to stand on a step and let your body push your heel down below your toes, and just hold it, and don't do a bounce, just hold that position. And I tell my patients to stretch their Achilles like they brush their teeth, just part of your life, hopefully twice a day.
Okay, I am adding that into my daily regimen. Doctor, thank you for being with us today.
It's a pleasure to be here.
And you can find this segment on firstalertfor.com/greatday following the show.